wouldn't want to waste much time and get started straight away because a lot of veterans are here, and the best thing for us is to allow them enough time to talk. And I believe that at the end of the day, we can learn something very, very useful in our life. So I would like to start with Pankaj Gautam first. We hear a lot about connected care, technology, a lot of things, particularly post COVID, is being spoken about. The question I want to ask you is, does this actually benefit the patients? And secondly, are there any challenges faced by the payee on this context? And the second question is, if at all we are able to adapt connected care, does it reduce the cost of care? Over to you, Pankaj.
Thank you, Mr. Ramesh. I guess first of all, thank you for having me here as a part of this panel discussion, and with such people on board. Coming to a question, Ramesh, I guess connected care definitely has benefits. COVID has only shown us in a bigger scale of what those benefits can be. Uh, Institutions like Apollo hospitals or other healthcare systems have been trying this concept for quite some time, and were successful to a certain extent, but not to a very large extent, because of multiple issues, because of also in terms of how clinicians looked at, how the patients looked at it, and how the healthcare in India traditionally has been something which was conceived as, until the doctor touches my hand, it doesn't make a difference. So I guess that has changed a lot because of COVID, where touch has become a strict no-no, and people want to stay away from people, and which might not be a very good thing socially, but especially for connected care, it has something which has kind of I would say catapulted into success. In terms of does it help? Yes, it does help. Like, I am sitting at home right now and talking to you guys. Earlier, we would have sat on a stage somewhere for a panel discussion, traveled all the way, and then away from the family and stuff like that. Similarly, I guess for patients as well, doing it from their home, where they are, access to health, to specialists, which is a very very big issue in India, especially in this market. Uh, if you go to a tier 2 tier 3 city where you do not have an access to a specialist like a cardiologist or an orthopedic surgeon or something like that, and I need an opinion, today you can do it through various platforms that are, and there are plenty third party platforms. There are platforms which have been created themselves by the healthcare systems. So connected care definitely is a boon right now and going ahead to the patients. I guess this is how healthcare would be practiced going ahead. This will become the norm, wherein for primary, at least for primary and follow-up care, people would want to, directly connect to the doctors over various platforms, and then try and see if they actually need to visit the hospital. uh, in terms of how it affects the pay part of it, I guess connected care is earlier it was not very well recognized, but I guess once the telehealth guidelines of the government are in place, government of India are in place, it has become official that teleconsultations or things like these are of can be used even in insurance payouts as well. So in terms of pay, I guess as of now, there are not much difficulties that the urban population faces. But maybe when we talk about remote areas, we talk about rural areas. Yes, people are still not very, tech savvy in terms of having using payment gateways and stuff like that. So maybe there still needs to be a lot more to be done. But at least in the urban tier 2 tier 3 city areas where everybody is used to using Paytm and stuff like that, I don't think payes as of now are facing any issues with respect to getting connected to their choice of doctors through any of the platforms.
Thank you, Pankaj. Thank you so much. Madhur, coming to you, I basically want to understand, does this connected care actually benefit the provider? That is one question. Second, like Pankaj had stated briefly, are there problems and challenges faced with the physician being a part of this connected care? And thirdly, does this actually propel health insurance? These are the three questions for you.
Hi Ramesh, thank you, and good morning to everyone and to our viewers as well. So I'll start. I think how providers can get benefited, and I think I'll start from where Pankaj left. The way it is helping these patients who are coming to us, I think the continuum in healthcare is one of the most critical things. And now for hospital, I mean, one way we can look at how it is helping us. And I'll just give one or two examples that there are many cancer patients where if they are not consulted on time, they can change, the stage can change to the next level. Now, specifically in times when people are avoiding to travel to hospitals, connected care actually comes as a very good solution to bridge that gap. Secondly, I would say that I mean, if you really see connected healthcare in true terms, it's really if I, as a patient, can walk into any hospital and my details are already there, though that ecosystem may take time. But if it is a single service provider, so currently what we have done in last few years, and I think digital plans every hospital had, but it kind of progressed fast because of COVID. And just to kind of touch upon some statistics, during lockdown time, our video consultations were around 68% of all consultations, which actually kind of fell down when it opened up to almost 25%. But if you see pre-COVID time, our VCs were less than 2%, which is if you see a non-lockdown time, even post-COVID now, currently what we are seeing, it's ranging 12 to 15%. So there is a definite increase in video consultations. And I think the if you cut down to these part, one is people who go back for a follow-up consultation. They really come on video consult. We are seeing people from international market, from feeder market. When I say feeder market, it's not our primary market where we are present. So someone from say West Bengal market and all that, they actually use these platform in a very very significant way. We also recently started a pilot with Google Health where specific to two specialities wherein we have started something, a remote monitoring of their vitals, which basis on elbows they can create, where doctor need to intervene and all that. I think what we are seeing, or any hospital, I would say, that till patient is inside hospital, we take care of everything. We make sure that nothing happens to the patient. Challenge is really when patient goes out, how do we make sure that we continue to get those vitals and we can take the necessary action at a appropriate time. That's where providers kind of fail. And theoretically, if you see, definitely it's going to help in a much critical way for providers. Two three areas. One is it can improve the medical outcome itself, because that's one thing which we are looking at, right? And so currently if we see, we may not be using the entire ecosystem, but there is already a progress. So if we so there is some medtech which we are using. There are these connected devices. We are using Fitbit as one of the device, which is kind of feeding in back information with some third-party apps on top of it. We are using our home health is one segment which has started using these technologies, and MedTel, which is teleconsultations and all, are already on. So that way, kind of, it is helping us for sure, providers like us. Your second questions on challenges on physicians. I would say yes and no. What we have learned when we started initially, we launched our mobile app video consultation platform. Now, it was difficult when someone calls, connect to this technology because there is always a learning curve, right, for physicians. And most of the times, as Pankaj was also mentioning, that touch and feel kind of thing. And doctors, when they see the patient, there are many things which they can't, and specifically tertiary care. I mean, brands like us where people come for tertiary and quaternary care, there are a lot of things. I mean, someone who's spinal, doctor will ask him to walk. He will even be just the way he's walking, he can tell where could be the problem and all that. So there were definitely challenges in the way doctors were using it more on a delaying or kind of managing these patients for some time rather than giving the solution which they should be doing in consultations. However, what we realized is that when we were moving to these Google Health and connected health platforms, initially only we had meetings with the entire, department doctor. For example, if it is ortho, we brought in the ortho department over there, had a detailed discussion with Google Health and these third-party providers, had a detailed, lengthy discussion, and the product which came out, out of that, what we saw is the adoption by doctors are very high. In fact, we started something, where only 50 patients need to be enrolled. But there were doctors, they were asking, I need more. Can I enroll more patients and all that? So that way, when we have a buy-in from them and they contribute to something when we are creating a product, because any product is not, can't be used off the shelf, right? There is some modification which are required. So that way, personal experience, I mean, working last 2 years with doctors, or specifically on connected healthcare, it's something which is picking up. I mean, we are seeing there is adoption by doctors themselves. And once they adopt, I think it is easy for us because they can convince patient why you should be using this, in what way it is going to help you. And last point which you mentioned is on insurance. I think it's a big piece. And if you speak to insurance providers, I think they are looking something like this because people who are fit, they continue to pay premium which they should not be paying. And internationally, it has already been experimented by many insurance companies where they provide incentives people who are fit, who are not using unnecessary healthcare and all that. And when it comes to connected healthcare, I think one of the most beneficial outcome is predictive healthcare. How can we play on proactive healthcare? And I think that's where insurance come in. Right now, what they have is based on some data which is available or which is coming based on the consumption of insurance. They are predicting what kind of consumption this person may have, maybe because of basis on comorbid condition, one health check, and all that. But if there is a real time data coming in, I think insurance companies can definitely will benefit quite a lot, which can also help a consumer to, once they start seeing some incentives and all that, the adoption of or the penetration of insurance, health insurance will also increase. So I think that's what I have to say,
Yeah, thank you, Madhur.
Ramesh.
It is remarkable. Thank you so much. Very, very useful insights. Dinesh, good to see you. Now, basic question
You
is this the new normal, the connected care? Is this the future of healthcare? Are people increasingly going to believe that healthcare can be delivered at home? Is it actually tenable and sustainable? That is one very clear cut understanding. Is it COVID or no, it is not COVID, it's something far more. And secondly, most importantly, are we seeing a new era where data and information are going to be the key? It is not about the analysis of the test done, which is one part. Data and information, is that going to lead the future?
Thank you, Ramesh, and good afternoon to everyone. And it is looks like a great platform actually when we are talking about something connected health. And actually, if I before answering your questions, Ramesh, I would like to go a step back and saying that these technologies for connecting was actually available if you look at 20 years back. Like Pankaj and Madhur has said that adoption has gone up very high during COVID. So that means sometimes crisis push us to adopt something new. And that is where the technology has played a very, very important role, and good we adopted it very well. And now if you look at it, a lot of invention has gone into developing, in fact, these technologies for connecting health together, which is actually growing very fast, and adoption has, in fact, has gone 68 times in last three phases of this pandemic actually, which is something very big achievement if I look at it. And through this, if you look at it globally, everyone, all the leaders are talking about how can we make this sustainable. This is something which everyone was looking at it, because expertise is available across the globe, and we cannot bring everyone on one table. I have come from the background of pathology, and if you look at it, the pathology, 10 years back, we invented, in fact, we started using connecting the diagnostics as well. That from US also someone can report, and now those technology were there, but now they are utilized very, very commonly. So I believe it is going to be very sustainable. Only there are three priorities which I would like to envision here. One of them is that our the bioinformatics and data integration is going to play very, very important role. And second important priority will be security of IT network, which is going to be, though there are some uh, relaxations are there in compliances, but still secure IT network is going to play second most important role. Also, adoption of the cloud-based platform, which is going to integrate these healthcare systems together, which will also bring a lot of flexibility and scalable model. We are a very large population country, and if we are going to make this scalable, then only it is going to be a more sustainable. Yes, adoption has gone to the public. It is going to be highly sustainable and going to be most important. And it is going to be not only for COVID, in fact, beyond COVID. Now everyone take telemedicine is there. I'll say this is only not connecting health, virtual health, telehealth has become so important, so common, not only for COVID, in fact, for everything. We look at it at a diagnostics center, all kind of tests are recommended now online. All test samples are collected. So that's one. Secondly, if you look at it, our overall virtual care is also happening. We are the first one to start. In fact, telegenetics also. Genetic counselings are happening online. So now, as Pankaj said, that touch was there. We have come from such a mythology country that जहाँ पे nerves देखते थे. Now that is not required. Nerves is available via oximeter. Yes, enough oxygen is there. So that's something which has come very, very well, and I believe it is going to be highly sustainable. Otherwise, we as the leaders of the country in healthcare, it is our responsibility to make it as a sustainable. It is going to be new normal. As Badur said that it gone down for when COVID was going down, and then it has come up again. It is going to happen for everything, but adoption has gone from 2% to 38 still, which is again very big achievement. So yes, I believe it is going to be completely normal and important to be adopted. But yes, if I answer your second question, is that data and information is going to play a very critical role. That if data is very well stored, very well managed, then data is going to become most important. Data and information, then only we are going to integrate and connect all the dots of healthcare. Maybe it is from height to weight to the demographics to the oxygen level to the weight and everything. Lot of connection there was missing in fact radiology and pathology and clinician. If we look at it, till yesterday our clinicians used to collect one file for radiology, one file for prescriptions, one file for pathology labs, and he has to look at the entire file. Now those kind of gadgets are available that they can see the entire history and all the reports of the same patient. So data and information has to play an important role, and yes, it is very, very important. That's what I would like to say. But this is something very interesting that we all should build it up further.
Thank you, Dinesh. That was really insightful and emphatic that connected care is here to stay. Balaji, I think we discuss daily, but the question I have for you today is connected care, do we have the entire ecosystem like I think Pankaj that said this? Does it cover everything together as a continuum approach? That is one question. And second and most importantly, I know Genwork is a very, very unique company. What does it do to basically encourage and make sure that connected care is here to stay?
Thank you, Ramesh. Thank you, and thank the organizers for inviting me part of this esteemed panel. So, Ramesh, coming to the point of connected care, I think first of all, as a medtech company, we believe that connected care should solve the clinicians' problems. Now, we see connected care from a technology lens, and we want the technology to solve the problems of clinicians. Like Pankaj sir was saying, Madhur sir was saying, that the tier 2, tier 3 uh, you know places and specialist non-availability is a big problem. So what Genworks we do is we bring multiple stakeholders, we bring technology, we bring OEMs, and we bring multiple partners into single platform and provide the connected care through our technology platform. So this is going to solve three problems. One is the access, second is the affordability, third is the availability. So I'll just give you a few examples. So what from Genworks we do is, we have access to multiple cloud-based and high-tech technologies, devices, and software platforms, which can do screening, which can do diagnosis, which can help in prediction of disease, and also which can help in supporting the treatment in the care pathway for the doctors, right? And what we do is, on the other side, we have physicians, doctors in tier 2, tier 3, and also the specialists who are available in hospitals like Apollo, Manipal, and Core Diagnostics, and many tertiary care hospitals. And there are a lot of single used or siloed technology companies who solve a small problem. So we bring all this into single platform to provide the care. Now that is basically what we do. So what this does is, this can provide a platform to solve all the problems. Like for example, when we take a technology, connected care technology to tier 2, tier 3, small towns or rural areas, and the local doctors can be connected to Apollo or Manipal, who present in big cities. Within 5 minutes, the patients get access to those doctors without being traveling, right? So that helps us to solve the access problem. And like Pankaj sir was rightly saying, that they don't have to travel many kilometers to take some small tests. Now today people travel many kilometers to take ECG test, or they travel to take cancer test, many blood test and other things, which is not really required. So that also solves the problem of affordability, because they have to take leave, they have to travel, their relatives have to come, they have to travel for the cost of travel. So many things are associated. And third is the availability. Doctors, specialists, clinicians sitting in large cities, just within 5 minutes or within few minutes, can access the tests of patients who are sitting many kilometers away, and provide those expertise. We have demonstrated this in multiple ways, and Apollo and Manipal are our key customers in providing this connected care. and especially Mr. Pankaj was the architect of the tele heart command center, which we have established in partnership with Genworks and Apollo Hospital. And so today what we do is we have connected many hundreds of physicians who are in outskirts of big towns to the main Apollo hospital, and we have a heart command center. So when there is a patient who goes to a clinic with some kind of symptoms of chest pain or any cardiac symptoms, the physician locally can immediately take a ECG test, which is one of the primary tests which are required for a heart patient, and within 2 to 3 minutes it gets transmitted to the heart command center. And from there, the cardiologist or cardiology associated doctors can immediately do the reporting, right? And if the patients are critical, within 5 minutes, the point of care diagnosis is done and the point of care treatment of initial level starts. And the patients are transported to the hospital safely within 1 or 2 hours, and that golden hour is for the patient is saved, and we have saved many thousands of patients through this, and we are expanding this network on a day-to-day basis. Even Manipal, we have done this with Kasturba Medical College, in Mahe, and we have connected few hundreds of PHCs and nearby districts primary care doctors through this. So connected care is not about telemedicine. Telemedicine definitely has gained adoption, but connected care is all about connecting the technologies, connecting the doctors, and providing the care at the right time and saving the patients. So that is what we do. And we have also developed our own platform to connect multiple stakeholders, multiple devices, multiple partners, which will help the doctor to get a holistic view. Because just a single parameter, like Mr. Dinesh was saying, having just single parameter is not going to help. So clinicians need multiple parameters. So we have our platform which can help to connect all these things. So that is the initiative what Genworks has taken, and we have been successfully implementing in a few areas. And as the panelists were saying, with the COVID, the adoption has been increasing. So we definitely hope that the adoption will increase more, and we can bring more more partners to the platform, and we can provide very holistic connected care to. And what we feel is that the patient should go to doctors only for treatment, the touch and feel treatment. Most of the tests should be taken nearby the hometown and connected to the specialist. So this is the initiative what Genworks has taken, and we have been successfully implementing in small ways, but with all the partnerships, we hope to scale up in the next couple of years. So that's what we are doing from Genworks, Ramesh.
Thank you, Balaji. Very insightful and taking a leaf of whatever you are saying. The question for now, Pankaj, is considering that you have started going into somebody's home, going to where the person is, rather than he coming to the care provider, does it mean that preventive care, which was not fully optimal to say, will it become a very important part compared to a typical approach of treatment? Is prevention going to be the future? That is one. And second, more important question, which I think patients will keep asking, is this whole connected care safe? Over to you, Pankaj.
In terms of the question of is it will it shift the mentality towards preventive care? Preventive care, for sure, for a country like India, has to be the way forward. With the kind of disease burden that we have in India, with the kind of NCDs we have in India, I guess this whole COVID drama has pushed the NCDs to a back burner. But once we are out of this, and I hope pretty soon, it is going to come back and haunt us again. Because what has it has also kind of done is COVID is, first of all, we don't know what the after effects of COVID will be there on the people who have been affected with COVID. Second is in terms of a lot of people who have started working from home, who have stopped a lot of their physical exercise because it mandates they do not go out and stuff like that, will kind of increase most probably the disease burden of NCDs within the country. So it is very, very important that we as a country move towards more of prevention rather than the reactive care that we are currently in. Having said that, in terms of connected care for chronic NCD diseases in the urban areas, for sure, preventive care is something that can be enabled, and that is being enabled by multiple health systems across the country. We are doing it quite well as well, especially for cardiac diseases, prevention of cardiac diseases, prevention of diabetes, and a lot of such chronic management programs, preventive healthcare programs. We are one of the world's biggest preventive healthcare providers that are there. But still, for it to percolate down in tier 2, tier 3 kind of cities, where the typical mindset to access a healthcare system is only when somebody is ill, it will take some time to bring in that mentality, and connected care can definitely play a big role in educating not only the people who are directly accessing any healthcare services, but also through the healthcare institutions which are at these smaller cities or smaller towns. So that is one part. And in terms of it being safe, it really depends upon how you're actually doing it. As Mr. Balaji said, it is all about the technology is the easier part of the game. The technology has the platform, and the technology has to be safe enough in itself on both ends. First of all, in terms of both, as Mr. Dinesh said, in terms of security of the data and the information that is being looked at while the patient is being accessing the healthcare service. It is also about what kind of service the healthcare system is providing, and whether the right diagnosis is being made at the right time to ensure that the patient is advised or facilitated to move to a physical healthcare facility whenever required. So I guess in terms of safety, yes, definitely connected care is the safest option, where you can find out what's wrong with the patient at home itself, rather than waiting for the patient to come to a healthcare facility and then finding out what actually is going wrong with the patient, with all the history taking and vitals taking, and then a lot of commotion and stuff like that. So yes, it is much more safer. I feel it is much more safer to get connected and then understand that what is the safest option for the patient to, and the best option for the patient to get the healthcare done at that any given point of time.
Basically, Madhur, now this leads us to a question. Everyone in the panel, and I think beyond, is talking technology. They, the question to you is technology-led healthcare, is it the new norm? For sure, because everywhere we only hear technology as the key. And second and most important, interoperability. Is that going to be a very big challenge? Because unless data is seamless, are we still not very, very clear about how we'll achieve the objective? And your views on how safe this is?
Yes, Ramesh. I think uh, it's good to see because we all are talking about the new norm and how this technology is playing a very critical role right now. Whether it will continue to be a new norm and the adoption will continue to increase. Simple answer is yes, because that's what we are seeing by all healthcare players. I mean, you have heard from Pankaj, and Manipal has same, and any other healthcare. I think the really way forward, what we need to see is that how quick and to what extent we can use this platform, right? And like other members in the panel have also mentioned, how this ecosystem kind of will be created. Now, what we are seeing is, I mean, if you ask me personally, and most of the these research reports which are coming, FAGMA, which is a new acronym in this space, which is for Facebook, Apple, Google, Microsoft, and Amazon, they are pouring in money in this space. And I think the entire idea is that how do we take this connected healthcare to next level? Now, when big companies come in, and also there is many other companies like, Balaji is doing a wonderful job in this space, and there are many other companies like that who's really making sure that this space is growing. Now, I won't go too deep in technology, but I think what is happening is, if we see the adoption of ultra wideband or other technologies, that those technologies will make sure that the data transfer or the usage is becoming seamless in future. So to that extent, I would say that yes, it is. It will be the new norm, and some of the things what Amway has done in US already, that there are home health kits which are available. Now it's a one-time expense where you deploy some of the cameras and some of the weighing scale and all that. I think what it does is that it automatically feeds in data, so customer need not to do anything on their own. So whether it is a fall detection, especially elderly people who are staying alone, the data can immediately shoot back to hospital or their care provider, so that they can take action, and including their family members also. But so the way technology is growing, I mean, in a nutshell, I would say that it is definitely we see it is going to be a new norm. We are seeing majority of the hospitals, they are building a new vertical, which is not IT, which is not I would say marketing, but it is in between something what is digital initiatives, or some call business technology and transformation. But this particular department, their entire role is to really bring in digital initiatives, bring in this connected healthcare or remote health monitoring, or there are many other things under this space, which can help consumers to kind of, start adopting to it. Second question, interoperability, I think very, very genuine question. And this is where, the biggest challenge we are seeing. I would break this into two-part interoperability. One is, what NDHM has proposed already. And now the biggest question is that, I mean, that's when, if NDHM kind of, vision comes true in India, I think that's when interoperability issue can be sorted out. But how soon, how difficult it is, that is what we need to see. Because is government going to ask private hospital to put in that much of money to change their entire IT system, current HIS and all that? That is, I don't know how many people really can go ahead and invest that kind of money. I mean, leave an old, bigger players. But if you go to, say, nursing homes and, other players, will they change? How quickly they can change? So till that happens, this part of interoperability, where consumer, whether I go to Manipal or to any other hospital, but my data is synced wherever I go, that's something which we need to wait and watch. However, if we see third-party apps which are outside available, which is coming from FAGMA or any other, that is still easy to kind of I would say integrate. Now, I think one point which came out, that how the usage of this cloud-based solution need to be increased. I think that is something which will help out. And but again, this is one system kind of, if I am within Manipal, so as a patient within Manipal, I can, use those services. The moment I jump to any other hospital and all that, then my entire data transferability is something which is a bigger challenge. So again, if I have to summarize this, if we are talking interoperability between two institutes, or like NDHM has said, it has to be pan-India, wherever you go, it should be available. We feel it is still a challenge because we don't have a clear path how it is going to integrate. I mean, operationally, how we are going to do it, we don't know as of now. Is government going to give some rebate if hospitals are investing money on that technology? uh, uh, talking within the system, within one brand, that's something which is already happening, and you will see continuous growth in that space. Second point, which I was talking about on the cyber security, I think specifically on healthcare, how do we kind of, cyber safety is something that area is growing. If you see, Philips has done some deal on cyber with Cyber MDX, and Cisco and Cerner have done deal. So this is a space which is kind of growing very fast. And there are many health tech companies which are tying up or aligning with these cybersecurity companies specifically for health tech space. So it is going to make safe, and I think Dinesh also pointed out that question that it is critical to make sure that the data, because in healthcare, data privacy is very very critical, and I think there are some legal implications on that. So any brand which kind of gets into this space, we have to be doubly or triply sure that the data is safe. So that space is growing, and I'm sure that with the kind of mergers what we have seen, what the kind of tie-ups what we have seen in recent past, this space is hot and it will continue to grow, which will make it further safe. So that's what I would have to say, Ramesh.
Thank you, Madhur. That was really enlightening. Dinesh, the question now is for you. Is wearables going to be the new paradigm in healthcare? Wearable sensor, etc. Is there a difference between connected care and continuous care? But thirdly, and most importantly, how are the efforts of the government in this particular context, and what needs to be done to make connected care greater adoption? Go to you, Dinesh.
Ramesh, first of all, I believe this is something actually very, again, a debatable concept where wearables is going to be continuous care future, and but I firmly believe it is an opportunity. Only the question would be how the data is. Is the data correct? Data is there or not? What kind of validations are done for proving these? For example, now a lot of information is available. Like if you talk about from step counting from wearables to oximeter, in fact, pulse monitoring. In fact, now one more thing is there is the hemoglobin care. Plus, recently there were 2, 3 more instruments and Genworks, something which I like. The few things which they have launched, if I remember it correctly, that colonoscopy can be done via now just a pic can be taken and can be reported from anywhere. That's a cloud concept which they are using. So a lot of such devices are available now. Only important thing which is going to be the most critical and important is the how data is. First of all, how the data is coming. Is that validation being done very, very well or not? That because this is all dependent on artificial intelligence. If AI is done and data is very, very validation is done well, then yes, data is coming accurate. First, second thing is, in fact, uh, is the training of the people. Like Madhur said, that's whether that BP is very well taken in the condition which is required. So we have to create such an ecosystem for critical cases management. For normal, then it's fine. It is going to be little 5-10% up and down. But for critical patients, these two parameters are going to play most important role. One is the training of the people when they are launching these instruments, these gadgets, and these wearables or sensors. And then second most important is the data. The validation is very well done or not. If those things are accurate, then integration of this all information at one place, then only a clinician will be able to take the decision. So I believe it is going to be an opportunity. It is important. It should be used, and extremely very, very, very important that we should use it. We should implement it. We should adopt it. And if these 3 parameters are very well taken, that's the first answer to your question. Second is connecting care is a normal care? I believe only if this data is correct. And yes, there are very good facts are available, and validation reports are there. These data are in maximum places is corrected. 98% accuracy is there. In fact, at some of the places, this precision has been much better through artificial intelligence. So that is why I would like to say that this is a normal care going to be. If I talk about government is right now is playing an important role, but uh, but only creating the ecosystem. How they have created 5G, they have created some norms in IT and security, cyber security. Some norms has been relaxed for IT networks. In fact, allowing telemedicine and all these things, that data interpretation can be done online. So that is how government is promoting it. Government is helping it. If globally, if you look at it, massive investment is happening in this area. Indian government, our government is also doing a lot of work. During pandemic, I have seen a lot investment is happening. Like if you look at one example of ICMR, a lot of data accumulation at one place, looking at all the things for one product, but one test or one disease. But going forward, it is going to be used for many other things also. So yes, government is also taking initiatives into it for creating the better ecosystem for utilization.
Thank you, Dinesh. Now, coming to Balaji, I think the final question for this round. Basically, you are dealing with a lot of people, Pankaj, Madhur, Dinesh. The question is, as a company like Genworks, how do you actually enable a very successful operationalization commercially of your products and services? You might have a lot of things, but these are to make sense to the patient, to the payee, to the provider, to the physician. How exactly you are addressing this particular issue?
Yeah, yeah, Ramesh. See, it's very important, you know, to for us to work on a scale, right? Because when we were also talking, Pankaj sir and Mr. Madhur and Dinesh sir, we're talking about technology and how, a lot of aspects of technology, cloud, security, and training, workflow. The doctor should have the right data. There are a lot of aspects here to, make sure that the connected care works. So, first thing, what we do is as a medtech company, we ensure that we have the right technology because we always feel that it is our responsibility to bring the right technology to the doctors, clinicians, so that we enable them to securely work and accurately do the diagnosis. That is, very, very important for us. Just to give an example, no, most of the devices, I would say, I'm not just trying to compare. It is something similar to a music system, right? You can have the best of the music, but if you have on one side a single channel speaker, or it could be a 7.1 9.1 channel with the Dolby Atmos, which can give you the right notes at the right intervals without mixing, right? So like BP or ECG or cancer images, whatever we speak, the doctors on the other end should see exactly the same how the body or the organs are sending out the signals. So the devices play a very important role. The technology play a very important role here. At the same time, it also should be easily operated because when you have connected care on the other side, you are not going to have a cardiologist or you are not going to have a oncologist sitting and operating all these devices. It is going to be a paramedic, it is going to be a technician, or at best it is going to be a general physician who is going to operate these devices. Third is the workflow. How the specialist on the other side wants these images to be captured. How the specialist on the other side wants the data to be captured so that they can make a meaningful interpretation out of this is also very important. And fourth thing is that this device, like other panelists were mentioning, it should have the security aspects, like the data security, cloud security, and also FDA approvals, C approvals, quality standards has to be maintained. So as a technology company, what we do is, it is our duty to ensure that the device what we choose, or the technology what we bring, adheres to all these things. It has to be, it has to replicate the originality. It has to have a simple workflow for a less skilled people to use it. It has to have the workflow for the specialist to understand the data, meaningfully interpret it. It should have data security aspects. It should be widely approved and accepted in many other countries, so that it can be accepted by the specialist in many places. And it should also have certain amount of training and self tests and AI and few other things which are built in. So that is what we do. So choosing the device is a paramount thing here. And once we have that, that is what we bring. And we have a group of technology specialists, like Mr. Madhur was saying. We have a digital team. We have people who are experts in IoT devices. We have people who are experts in AI. We have people who are experts in software applications and the latest software coding and other software architecture. So we bring in those technologies, try to integrate in the country. And second, once we have the proper technology, second comes to the cost, because all these technologies can be very expensive, right? So second aspect is the cost. So what we do is, when we partner with big international companies, India has a big volume, and we have to crack the volume and cost balance, right? Because at low volume the cost can be very high, and at higher volume the quality can be compromised. So we have to strike the right balance of cost versus volume. That is where we work with multiple financial partners. We work with multiple partners, service providers, and decode this into an OPEX model. Because when we go to such hospitals with an OPEX model, where we can talk about pay per use, we can talk about patients can pay per cost. And we are a B2C player, B2B player. We are not a B2C player. So when we go to Manipal, Apollo, Core, or any large hospital, we have to give them in such a way that they don't invest too much capex, but at the same time they take it to the mass patients. So we work on multiple OPEX and business models, which will help us to multiply the volumes and bring down the cost. And that is the difference between a company like Genworks and a small distributors, because we can provide that scale. We can operate in multiple countries. It is just not in Karnataka, or it is just not in Tamil Nadu or one state. We can operate in all over the country. We can bring that scale. We can also go to other countries, and we can enable the healthcare, and the cost can be balanced. And we bring a lot of service providers, right? For example, we can bring in third-party radiologists, third-party cardiologists, who can share their time in interpreting certain data, in interpreting certain images, and also help the hospitals and doctors to save the cost of having their own specialists. So we do multiple things to bring down the cost, and so that is very important for us. And also the volume, scale, and other things are very important. So these are the few things which we do, Ramesh, to ensure that technology reaches every corner of the country. At the same time, it is also cost effective, and also it is not putting a lot of financial burden to the hospitals and to the patients.
Thank you,
Just
Balaji.
to add on here, there are people like us who then force Balaji to give us the cost that fits our business purpose. So that's that.
Thank you so much, Balaji. That was great. I think personally, it has been a great learning experience for me. Everything discussed today, so meaningful, so useful, I believe that we should do more such sessions so that everyone benefits from the pearls of wisdom to say. O to VOH.